Hello again. So based on a video I just made, I wanted to make this video on bisecting angle technique to explain what it is and to differentiate it from parallel technique, which is the traditional one that's taught in most of the radiology books. So this is what is meant by parallel technique. The parallel is the long axis of the tooth and the sensor. Those are lined up parallel with each other. So the sensor has to be a bit away from the tooth in order to achieve this. And then the X-rays come in at about 90 degrees to both of those lines, so the long axis of the tooth and the sensor. Same is true for the mandible. All right, so everything's just lined up orthogonal to where the X-ray beam comes in. Now, in some cases you want to do this, some cases you have to do this, where you have to turn the angulation of the sensor to where it contacts the crown of the tooth. This is commonly done in endodontics, when the patient is holding the sensor in there in place and it's right up against the crown of the tooth. And in that case, if you still try to maintain parallel technique and hold where the X-ray source is coming in orthogonal to the long axis of the tooth, is that going to cause elongation or foreshortening of the image? Well, if you look at it here, this image of the tooth is stretched out. It's stretched out over the length of that sensor, so that's elongated. Same is true for mandible. You just have to orient it in the other direction. The sensor leans up against the crown of the tooth. If you still come in at a 90-degree angle to the long axis of the tooth, you've created elongation. Now let's look what happens if instead we change the angulation of the X-ray source to come in at 90 degrees to the angle of the sensor. Is that going to create foreshortening or elongation? If you look at the projection of the image of the tooth, it's actually going to be shorter. And the more severe the inclination is, the higher degree of foreshortening you're going to create. And so this creates foreshortening. And so how do we eliminate either foreshortening or elongation? Basically, all you do is you split the difference. So go in between. So look at this now. We're not quite as flat of an angle as if we're 90 degrees to the long axis of the tooth. And we're not as steep of an angle as if we're trying to come in at 90 degrees to the sensor. And so we're in this Goldilocks zone, just right. And so that's how you eliminate foreshortening or elongation. You should get proper proportions of the tooth if this is done correctly. And you're better able to see the structures you want. You can measure the structures you want. So excellent method to know for when doing endodontics, and those measurements are critically important for getting the right length of your canal. All right, short video. Thanks.